Hi, Jonathan Hobbs here, developer of the Hobbs Masters Needling Series and chairman of the AACP in the UK. Just want to talk to you for a moment about a concept of the Triumvirate of Respect. When I'm talking to clinicians about practicing, there's certain things that I'll say about clinical reasoning and different techniques and different approaches and how we address any condition. And one of the things I'll say is that there's nothing really cast in stone when it comes to acupuncture and needling. Yes, there are lots of different techniques, and you'll go on different courses and you'll read different books and you'll come up with all these different ideas. I'll say there's nothing really cast in stone apart from two things. That's the concept of non-malevolence and beneficence. So first do no harm, then do some good. And within that, classically, what I'll talk about is the triumvirate of respect. And that is respect the patient, respect the anatomy, respect the technique. Now, when it comes to those three things, providing we respect the patient, and that is everything about them, it's not just when we put our hands on them, it's how we speak to them. It's also how that relates to evidence-based practice, which we've talked about previously, and patient expectation and needs and wants. So we respect the patient first of all, first and foremost. We respect the anatomy, how we palpate, how we assess, and definitely how we needle. We're thinking about not just how we needle, but where we're needling, what's going on underneath that. We're performing an invasive procedure. So it's beholden on us to know what's underneath that tissue and where we're going. And lastly, but also very important, is to respect the technique. Now, don't get confused with these. Technique doesn't come before anatomy or the patient. If you just rely on technique, but your technique is in the wrong area, you can end up with all sorts of problems. So, as long as you respect the patient, respect the anatomy, respect the technique, you're never going to have any problems. And providing you're thinking about the concepts of non-malevolence and beneficence, everything is going to go well for you. So add those into your clinical reasoning, and whenever you're putting your hands on a patient, whenever you're performing an invasive procedure like acupuncture or dry needling, consider those three concepts. I'll speak to you again soon about clinical reasoning. I look forward to it. All the best.